Good day, colleagues. Good afternoon, colleagues. We just want to do a mic check. So I would like to greet Professor Marwala, if we can just greet the meeting before we go live. Thank you very much, Marwala. You are audible. And then Professor Olivia. Thank you very much, Prof. That was audible. And then Miss Thandeka Ellenson.
Greetings, colleagues. Good afternoon.
Thank you very much, Miss Ellenson. Ready to go live.
Good evening, everyone. Good evening to all those who have joined in. My name is Ravi Pillai, and I will be programming this very important webinar. And we'd like to start to be reasonably on time. Let me recognize the Honorable Premier, Mr. Sishla Zikalala, the Vice Chancellor of the University of Johannesburg, Professor Chilidzi Mawala, the Director of the KwaZulu-Natal Research and Innovation Sequencing Platform, Professor Tulo de Oliveira, the CEO of the Moses Kotana Institute, Ms. Thandeka Ellenson, and all those joining us on various platforms such as Facebook, Twitter, and YouTube. Members of the media, ladies and gentlemen, comrades and friends, good evening. As I indicated, I think this is a most important webinar. I welcome all the panel participants and also all those who have logged on to this very important webinar, notwithstanding the fact that it's a Friday afternoon, evening. I wonder how many of us would be involved in this kind of work in a pre-COVID period on a Friday afternoon, evening. But that is the importance of the task that we are doing so. The purpose of this webinar is twofold. Firstly, and most importantly, it is about the fight against COVID-19, which I believe all of us understand is the single most important issue confronting us in our country, South Africa, and indeed the world. And when we are in the midst of this battle, indeed war against the virus, which our best scientists and thinkers have analyzed and given us the messages that are clear, while we are in the midst of this war, there are those who, for whatever reason, damage or destroy cell phone towers because they have been told that 5G causes or transmits COVID-19. When this happens, we have a responsibility to respond and debunk incorrect beliefs. So the fundamental purpose of this webinar is to educate ourselves and our people about the truth of these matters. We cannot be distracted. We cannot be defocused from the central task of fighting COVID-19 with the tools that we have been given, both medical and non-medical. We have therefore put together a panel whom we think will be able to speak authoritatively about the subject. Hopefully the MEC for Health will join us at some point, MEC Nomagugu Similane Zulu, who has been in the front line in our hospitals, in the public sector, every day since the beginning of the pandemic in our province. We have the CEO of the Moses Kotane Institute, Ms. Thandeka Ellenson, who will give a presentation on digitization of KZN province, including the 5G network. Then we are quite pleased to have Professor Tulio de Oliveira from the University of KwaZulu-Natal, who will speak on the basic science of COVID-19 from a virologist's perspective. Then we will have by Professor Marwala a presentation addressing the myths and perceptions from the public. Finally, we will have our Premier, Mr. Sishla Zikalala, who will be introduced at the appropriate time with a closure by Mr. Kubega, who's the DDG for Stakeholder Management in the Office of the Premier. I must add that while that fight against COVID-19 is our first priority, of almost equal priority is appreciating and educating our people about the importance of technology and 5G and indeed subsequent 6G and others that will evolve over time to our economic growth and our competitiveness. We as KZN are determined to develop our economy and create jobs. Currently, we are facing a jobs massacre. But we cannot do this without being competitive in every field, including that of technology and the latest technology at that. I believe that we as KZN have a vision to grow our economy over time to become, it has the potential to become the biggest economy in South Africa. When we started off in the battle against the virus, we broke our fight with 4 pillars. The first was the health sector, the medical side of it, getting our hospitals ready, our nurses, our doctors, the infrastructure, the health public education side. Secondly, we had to deal with looking after the vulnerable, because there were many vulnerable people whom we had to make provision for. Thirdly, was looking at the enforcement and the regulatory framework, which required a lot of work by many people in our country. And fourthly, from the very beginning, we understood that a most pillar would be the economy, how we manage the impact on the economy and how we start to plan to build our economy. In the course of that in KZN, we broke up our economy into 11 sectors to say how will this economy grow and how we will be able to stimulate it. And I can say that one of the top three that emerged was the sector of the ICT sector. And so we cannot undermine the potential for one of the most important sectors in the economy today worldwide. Let me also use this opportunity to appeal to very important stakeholders: the religious sector, traditional leadership, civil society generally, and young people, because it's the future of young people that's at stake. In all these sectors, let me repeat, our religious leaders, our traditional leaders, leaders in civil society, and young people must take up this battle and take the message to all corners of our country. They must become central to this fight. So let us educate ourselves and spread the message. This webinar is, of course, just a first step in a campaign to educate, openly discuss, and empower. And I wish all our participants successful deliberations. Let me then move to the first substantive item on the agenda, which is the digitization of KZN province, including the 5G network. We are most pleased to have Ms. Thandeka Ellenson of the Moses Kutana Institute to give us her presentation. Thandeka.
Thank you, Honorable MEC. Greetings to Honorable Premier Sihlezi Galala, Honorable MEC Ravi Pillay, Honorable MEC Namagugu Simelane Zulu in absentia, and all the Honorable MECs that are in attendance here today. I'd also like to greet Prof. Marwala, as well as Prof. Oliveira and other colleagues that have joined us from the private sector, and all the viewers at home and in the work of places. Thank you very much. I'll share a presentation, and I would like to alert you that my talk is going to be in isiZulu so that we can all benefit from this presentation. I think you can see my presentation, if I can get an indication. Can my presentation be seen?
Yes, Thandeka, it is visible. Thank you.
Thank you very much, Honorable MEC. All right, so digitizing KwaZulu-Natal and 5G is what I'm going to be talking about today. But the issue is, what is digitizing? Kuyini khona lokho ukudijitize? Suke sisho ukuthini uma ngabe sithi siyadigitize? Sisuke sisho ukuthi siguqula yonke into ekhona esinayo endala siyenze ukuthi itholakale kalula kuma-devices ethu. For an example, ama-cell phones ethu, ama-computers ethu, ama-TVs, imisakazo, nakho konke okunye. Awucabange nje iKwaZulu-Natal where you won't have to stand in a queue. Ucabange iKwaZulu-Natal la ungathola khona yonke into yakho from i-device, either i-cell phone noma i-computer noma i-TV. Kusiza ngani na ukuthi si-digitize iKwaZulu-Natal? Kusiza ekutheni si-improve ama-processes ethu, sinqamule i-red tape, si-improve i-accessibility, senze sure ukuthi i-service delivery iyashesha, itholakala ngokushesha, senze sure ukuthi uhulumeni uyakwazi ukufinyelela kalula kuma-citizens, nebhizinisi liyakwazi ukufinyelela kalula kuma-customers, nama-citizens ayakwazi ukuthi afinyelele kalula kuhulumeni kanye namabhizinisi, osomabhizinisi. So kubaluleke ngaleyo ndlela ukuthi iKwaZulu-Natal si-digitize, sibe amongst abanye abantu emhlabeni abaphambili ekutheni nge-technology si-advance. So uma sikhuluma-ke ngokudigitize, KwaZulu-Natal sine-digital transformation strategy ekuyiyona eyaphasiswa ngo-2020 ngoMeyi. Isiza ngani ki-digital transformation strategy? Isiza ngokuthi sikwazi ukuthi si-interact as different stakeholders njengoba kade ngisho. Inama-pillars-ke awu-6, kusho ukuthi ineyinsika eziwu-6 i-digital strategy yakwaZulu-Natal. Iphila yokuqala i-connectivity, eyesibili i-digital skilling, eyesithathu ukugcina i-information ne-security, and so on and so on. Size sifike la ekutheni ugovernment wethu nawo u-on par with all government abasemhlabeni abaphambili ba-digitized. Kodwa-ke okwanamhlanje sizokhuluma nge-connectivity kuphela, which is i-digital transformation strategy pillar 1, ekuyiyona-ke esixhumayo ngoba i-5G iyi-part of i-connectivity. Ngiya-understand ukuthi nginikwe isikhathi esincane, so ngizozama ukuthi ngisheshise. Uma sikhuluma nge-connectivity-ke iningi iy'ndlela zokuconnecta, thola ukuthi kune-fiber connectivity le embelwa phansi, kune-radio microwave le-ke othola ukuthi isiza uma ngabe kuwukuthi i-fiber ayifinyeleli, kune-copper cable connectivity leyo-ke siyafezwa out ngoba vele abantu isindala kakhulu nokuthi abantu bawantshontsha-ke ama-copper, so yafezwa out-ke leyo. Khona nenye-ke kuthiwa i-spectrum TV white space la uthola ukuthi khona usebenzisa ama-channels athile kwi-TV yakho uku-accessa i-connectivity. Kube nenye ekuthiwa i-satellite internet connectivity, leyo-ke iyi-connectivity ecishe ifana nokuthi njengoba usuke ubona i-dish ekhaya, i-satellite dish, uyidonsa kanjalo-ke nayo iza ngedish ekuthiwa-ke i-satellite internet connectivity. Uma ubuka i-status se-connectivity KwaZulu Natal, baningi abantu abafisa ukuthi ba-accesse i-internet, kodwa-ke kunama-limitations. Masibuka i-internet access ngokwakwaZulu Natal, siyathola ukuthi-ke ama-cellphones bawu-48% kuphela abantu abakwazi ukuthi bathole i-internet access ngama-cellphones in the province alone. Bese kuthi abanye-ke bayi-accessa i-internet through iy'ndawo zokusebenza, through ama-libraries, through amakhaya, i-connectivity emakhaya, abanye kuma-internet cafes, kanjalo kanjalo. Uma ubuka i-status se-connectivity eKwaZulu Natal, siyi-status esithanda ukuthi sibe buhlungwana. Ngani? Ngoba uma ubuka laphana uphaya wami lo onombala obomvu nombala ohlaza, siyathola ukuthi baningi kakhulu abantu abangekho connected, kakhulukazi ngolayini o-fixed. Sithi 81% of abantu abekho connected. Mawehla kule block yami yangezansi, uzobona ukuthi laphana ngokwakahulumeni u-government u-connected only u-27%. Lokhu-ke kubuhlungu kakhulu ngoba kusho ukuthi kuney'kole ey'ngakhonektiwe, kunamaklinikhi angakhonektiwe, ama-police station, ama-libraries and so on and so on. Kwenza ukuthi-ke siKwaZulu Natal bengathi sisalele emuva nge-connectivity ngoba manje masithi u-government alone is 27% connected, kusho ukuthi kunenkinga lapho. We're not even at 50% connected. Uma ubuka ngokwama-private residences, emakhaya si-connected u-9% kuphela and not more. Lokho futhi kusinika inkinga ngoba kuyacaca ukuthi even emakhaya noma ungasuka emsebenzini uma usufika ekhaya ayisekho i-connectivity. Masibuka-ke ngokwe-age group yabantu aba-connected KwaZulu Natal, siyathola ukuthi ba-range between the age of 20 to 60. Kusho ukuthi-ke mhlambe laba bangaphansi ka-20 laba basesey'koleni, laba bangaphezu ka-60 ilaba mhlawumbe sebeya towards i-retirement. Ziningi-ke izathu zokuthi-ke banga-connect. So uma ubuka i-general connectivity status yase-KZN uyiqhathanisa ne-status sase-South Africa, asikho khona kabi kakhulu ngoba kuyasho ukuthi nalo izwe South Africa vele ayikho connected kahle hle. Kodwa-ke siyiKwaZulu Natal ziningana iy'ndawo ezithi ayikhale ngaphansi. Uma ubheka nje laphana kwa-education, sithi asikhale ngaphansi kancane nje kwe-South Africa, because education we need to make sure ukuthi siya-upgrade, siyayi-connecta iy'kole, siya-connecta wonke ama-places ezemfundo. Iy'ndawo zokusebenza zingaphansi kwe-South Africa, ama-libraries-ke yona-ke acisha athi ukuba ngconywana ngoba e-South Africa uma uqhathanisa ubuka uzwelonke impela kuyashoda ema-libraries. Ey'ndaweni zokuhlala sikhala ngaphansi uma ubuka i-connectivity and so on. Uma usubuka-ke i-connectivity ngokwama-districts, siyathola ukuthi-ke uma ubuka nje for an example ugu siliqhathanisa neKwaZulu Natal province yonke kanye ne-South Africa eyonke, ugu district likhala ngaphansi kakhulukazi ngizogxila ey'ndaweni zasemakhaya zokuhlala. Uma ngithi iy'ndawo zasemakhaya, I mean residential places, dwelling places. So siyabona-ke ukuthi-ke ugu district likhala ngaphansi, alukho connected kahle, liyashoda. Herigwala district iyashoda, zikhona iy'ndawo zithi ukuthi engafisa ukuthi iphakame kancane, kodwa mawubuka nje i-range yonke ikhala ngaphansi iHerigwala district iyayidinga i-connectivity. uMgungundlovu uthi awube ngconywana ngasey'ndaweni zokuhlala mawubuka emakhaya, kodwa ikhona iy'ndawo ey'khala ngaphansi ey'dinga uku-upgrade-wa, ikakhulukazi nje mawubuka iy'kole for an example. Kodwa-ke iy'ndawo zokusebenza zithi ayibe ngaphezulu. Mawubuka iLembe iy'ndawo zokuhlala y'khala ngaphansi, and many other places indawo zokusebenza, education uyashoda and other places. iLembe lidinga ukuconnectwa. uMzinyathi needs connection. Mawubheka 3.3% kuyadabukisa kakhulu ngoba mawuqhathanisa no-8.8% weprovince, kusho ukuthi nje uMzinyathi awusekude kakhulu. Kufanele siyi-fast track indaba ye-connectivity. uThukela 4.2% khala ngaphansi, uThungulu 7.1% khala ngaphansi, amajuba 6% alukho connected, awekho connected amajuba. iZululand district kuyadabukisa kakhulu ikhala ngaphansi in terms of connectivity. uMkhanyakude indawo zokuhlala 3.9% uyadabukisa, kuyadinga ukuthi kuconnectwe lapho fast track. So masibuka-ke bakwethu nge-status se-connectivity eprovinsini, ziningi impela. There are lots of places that still need connection. We are so far behind and we do need to be connected as a province, including our government, because government is only 27% connected. If you look at the slide that I've put in front of me, you'll notice that I've beamed up MTN, Vodacom, Telkom, and Cell C. This is statistics Sango 2019. We see here the trend that we had 2G, then we moved to 3G, we moved to 4G, and now we are in 5G. So, but you also notice ukuthi mangabe lately mangabe sithi siya kwi-technology entsha, siqale sibe reluctant singayi-embrace kahle. Therefore uthola ukuthi iy'namba zethu zincanyana compared to the previous generation. So kusho ukuthi-ke ne-5G-ke ikanjalo-ke njengoba sikuthi 2G, 3G, 4G zithanda ukuthi iy'namba zethu zihambe kancane. Masibuka ngokwe-5G eprovinsini kunenkinga ikakhulukazi. Well, siya-acknowledge ukuthi sesikuyi-5G era manje. Ngenhlanhla futhi enkulu vele akukho ukubuyela emuva ngoba phela ingane awuthi uma usuyizalile bese uyiphindisela esiswini. i-5G ikhona bakwethu, akulula ukuthi sithi asizu-advance. i-5G iyi-natural technological innovation or technological evolution. Kusho ukuthi ngamanye amazwi vele phela ngeke size sihlale kwi-generation endala forever. Kuhamba kufanele sinyuke. Mawubuka nje emhlabeni wonke jikelele, ba-predict ukuthi ngo-2025 i-5G connectivity abantu ababe sebe-subscribe bayobe bewu-1.7 billion. Lokho-ke kusho ukuthi-ke i-subscription yabantu abasebenzisa ama-5Gs izonyuka njengoba senibona nakoma-TV nama-radio sebeqalile manje ba-advertise ama-cellphone contracts nazo zonke lezi zinto ezithi 5G. Lokho-ke kusho ukuthi sesingenile impela kwi-era ye-5G. Iyasisiza-ke i-5G ukuthi-ke siyibhrije ukuhlukana ngokokuxhumana ey'ndaweni zasemakhaya versus iy'ndawo zasemadolobheni. Kodwa-ke sinenkinga enkulu njengoba ifikile i-5G ngoba kuyavandalizwa ama-5G towers eprovinsini. Avandalizwa because of misconceptions, because of all the circulating voice notes against 5G, because of people who believe that 5G is a cause of this, that, and that. So-ke kuthanda ukuthi kube inkinga kakhulu because this has set the province backwards in terms of connectivity, meaning we are now not able to meet up with the goal of connecting the province as per our digital transformation strategy. We are sort of lagging behind, and in fact, we are taking 10 steps backwards as a province when we vandalizing 5G towers. This is a problem bakwethu emphakathi wase-KZN ngoba manje kusho ukuthi thina amanye ama-province ayosidlula njalo ngenxa yokuthi thina KwaZulu Natal sikholelwa yilokhu esikukholelwayo bese sidestroye impahla. Okubuhlungu kakhulu ukuthi ngesikhathi kulimazwa ama-5G towers kuvele kulimale yonke i-connectivity. You cut out all forms of connectivity when you destroy 5G towers because it means the 3G towers and the 4G towers are also destroyed. It's a big problem. Okay? There is a status of vandalization that I've put up in front of you, but engingakusho nje kakhulu ukuthi ey'ndaweni zasemalokishini, that's where the problem is, la kuvandalizwa khona ama-towers. Siyabona la ukuthi maningi kule column ebhala ukuthi vandalized successfully, kuno why, kusho ukuthi-ke lezi ndawo njengoNtuzu, Mananda, KwaDabeka, Folweni and so on, avandaliziwe ama-towers kabuhlungu. Bese kuthi-ke lezi ezinye futhi engithe kusaphenyo basabheka-ke khona njengoDindeli noMbali ukuthi kwenzakalani, kodwa-ke kube nama-attempts lapho ukuthi kuvandalizwe ama-towers. Kuyinkinga kakhulu. Mawubuka i-5G coverage in the world, uzobona-ke la on the left hand side iyaveza i-map yami laphana, iveza amachashaza a-purple avezayo ukuthi i-5G connectivity sifakiwe America, yafakwe Europe, yafakwe Middle East, Australia and some countries in Asia, yafakwa nakuma-islands athile. But now when you come to the right hand side, this is South Africa now, and you look for the purple dots, you won't find them. Why? Because it means ukuthi South Africa i-connectivity yama-5G towers ayikho, it's lacking. So sikhala nge-5G towers nje akakafiki ngisho ezingeni lokuthi sesingaze sithi hayi akhona wona ama-5G towers ayasilimaza. Kodwa mawuya lapha ezansi eCape Town uzobona ichashaza elincane eli-purple khombisa khona ukuthi eCape Town akhona ama-5G towers. Noma-ke i-status sokuthi bona bayavandalizwa singekho kwi-bed light njengoba sikwi-bed light thina KwaZulu Natal, okuwukuthi-ke sibukeka kabi kakhulu thina njengomphakathi kwaZulu Natal ngoba sibukeka sabantu abacekela phansi impahla, aba-backward, abangafuni uku-advance, abangafuni ukuqhubeka ne-technology. Ingane-ke awuthi uma usuyizalile mawuzwa kuthiwa kunenkinga bese uyinqamula iy'nyawo, siye sithole yonke usizo esingalithola ukuze senze sure ukuthi le ngane iyakhula. I-5G-ke iyona ngane yethu ekufanele siyikhulise, asingayilimazi, asingayivandalize. So in summary, digital transformation strategy of the province is promoting connectivity as the first pillar, and the stats are showing that there's less connectivity in KwaZulu-Natal compared to other areas. We are showing that there are many municipalities in the province that are lacking connectivity that need to be connected, including residential areas, the schools, the clinics, the police stations, the libraries, and so on. Vandalizing the connectivity towers is setting us back as a province, and we need to progress. So the question is, should we embrace technological advancements, or should we move backwards as a province? That is the question. So therefore, in conclusion, I'm saying, so if the whole world is moving to 4G and from 4G to 5G, should we then as KZN stay in the same position, or should we move forward with the rest of the world? Njengoba ngisho-ke ukuthi njengoba amazwe exhume i-5G beqhubeka beya phambili, thina kufanele senze njani? Sihlale singakhuli noma simuve nomhlaba wonke singene kwi-5G? That is a question engiyibeka khona ebandla namhlanje. Ngiyabonga kakhulu. Thank you, Honorable MEC. I will end there. My presentation was in isiZulu, and thank you very much for the opportunity.
Thank you very much, Thandeka, for a very crisp presentation. It's very clear. It tells us where we are in KZN. Our connectivity is low. And she poses the question, do we want to rise to be amongst the most connected? Do we want to be connected and competitive? Or are we going to allow us to be taken 10 steps backward? The world map she showed us was very indicative. And may I add that a priority program of this provincial government is developing the township and rural economy. Developing the township and rural economy. And these are the areas where these towers are being sabotaged or destroyed. Thank you, Thandeka, for that presentation. Let us then move to the next item, which is the basic science of COVID-19 from a virologist's perspective. And we are most honored and pleased to have Professor Tulio de Oliveira, who's from the University of KwaZulu-Natal. I'm sure many of us have already seen him on television, explaining things to us. And Prof, we are delighted to have you, and I invite you to make your presentation.
Yeah. Thank you. Thank you for this invitation. Yeah, I'm very honored to also be here with all our MSCs, of the province and the Premier and the MSC of Health. Yeah, and which is very important. Yeah, to also bring some basic and some scientific evidence to try to fight this kind of myths, such as that 5G technology, which is fantastic for development of our nation, could cause disease. So many of you will be aware that I normally have like weekly radio interviews and some TV. And as part of that, is really to try to explain some of the very basic information, and how can we bring science to the forefront to fight this pandemic? Of course, that our government has been very supportive of our efforts, both regionally at KwaZulu-Natal, but also nationally. So what I'm gonna try to do for you here, it is just build quite slowly some of the facts of this terrible disease. What's an awful disease? So let's start from the beginning. Some of us may not even believe that all of that started 380 days ago. So that was the first warning that came. It came 2 days before the new year of 2020. On 30th of December of 2019, when the first case of undiagnosed pneumonia were detected in China. And since then, I think that everyone understand what's happened. Since then, we build a lot of knowledge on this unusual case of pneumonia. The first one, it is just to make very clear during this presentation, is that we have a virus behind that. And the virus was named as SARS-CoV-2, which it means severe acute respiratory syndrome related coronavirus 2. Why the virus got this name? The virus got this name because it can create a very severe respiratory, which gives rise to pneumonia. And it came from a family of virus that's very widespread called coronavirus. And that's the second main variant. So that's why we call COVID-2 that have came in the last 20 years, with the first one being like 20 years ago. And then that also called a disease, a very serious disease, so COVID-ID or coronavirus disease 2019. And I'm gonna use some of this terminology during this short presentation. It will be about the virus name, SARS-CoV-2, but also about the disease COVID-ID. So imagine just a year and 15 days ago, and now we have this massive pandemic. So this is data published yesterday at the World Health Organization, which show in red countries that have like either more than 100 or more than 300 cases in the last 7 days for 100,000 population. That's a metric that we use, so we can compare apples to apples. And you're gonna see that unfortunately, South Africa is back in one of these dark red colors. But in the world, we get 88 million confirmed cases. Soon we're gonna get to 100 million cases, with basic every country in the world suffering as part of this pandemic, and we're getting close to 2 million deaths. So just to understand a little bit, and I'm just gonna take you through a second, that's also a very recent data from the World Health Organization. In the x-axis or in the bottom of the graphic, you have the date. In the y-axis, we have the number of cases and the number of deaths. And the main take home from this graphic is that the epidemic is still expanding, yeah, and is expanding almost everywhere in the world, yeah. What's happening in South Africa, unfortunately, it is happening at much faster speed in Americas and in Europe. And not only the cases are increasing, but also, unfortunately, the number of deaths. If you put this disease, the COVID-19, in context with other pandemics, yeah, we are at the moment of the second most the first three are the pandemics that are associated with coronavirus, the SARS and MERS. They were much smaller than the SARS-CoV-2. And in the bottom is the pandemics that are associated with influenza, yeah, which is a completely different virus, but can also be devastating. Yeah? So at the moment, we just lose for a pandemic that happened 102 years ago of the Spanish flu, but it's quite serious. And I think that what we are seeing is going to grow a lot in the next few months. So what is the situation in South Africa? The situation in South Africa, it is what I'm showing two graphics here. The top one in purple is the number of cases. Yeah, as you know, our second wave was much more severe than the first wave. We had so far 1.3 million cases in South Africa, and we are averaging 17,000 new cases a day. The bottom graphic, something that we keep a close eye, which is the rate of the growth of the virus. What it means, the rate of the number of infections that grow. Unfortunately, we have a R, or the reproductive number is still above 1. So we haven't peaked yet as a country in the second in the second wave. And we never know if the second wave is going to be the same as the first, that's going to go down, or if it's going to happen what's happened in the UK and the US, that the second wave went slightly down and shoot up again. So that's why we have to take very serious all of the suggestions, both from our MEC of Health of KwaZulu-Natal, but also from our health minister and president. And we really have to take this pandemic serious. Yeah. If you look at the number of deaths, and that's unfortunately is only when people take serious, when they know the loved ones that they die, it's really sad. Yeah. Not only the deaths is growing, sorry, it's repeated my number of cases there, but we have now in average 5,000 deaths every 7 days. Yeah, it's really, really scary. We may be one of the countries that beat what you call the 1,000 deaths a day. What's a very sad statistic, and it's getting almost double of the first epidemic, the first wave. Yeah. So just here, as we just look just on the deaths, yeah, what you see is this massive growth with no sign of decrease of the deaths yet. We have what we call a case fatality rate of 2.5%, yeah, and now average 500 to 600 deaths a day. Yeah, it's very worrying, especially because we believe that this deaths is a very underreporting. I will come to that quite quick here. As you are aware, a few weeks ago, we described with our health minister a new variant of SARS-CoV-2 in South Africa. And this variant, it's spread much, much quicker. And that's one of the reasons why we saw this big increase of cases and deaths before our summer. Yeah. This variant doesn't call a higher case fatality rate, but if it spread very quick, our hospitals get overwhelmed very quick, which end up with more people dying. What's happening? Yeah. So some information that I was asked to present today. Yeah. It is the association of death or case fatality rate with age. And one thing that we saw all around the world, doesn't matter which country we look at that, including South Africa, that is linearly associated with age, yeah, and that's also linearly associated with the number and severity of chronic diseases such as diabetes or sometimes even obesity, yeah. So that's what we see. If we compare the South African, what we call the population pyramid, and here we have the female and the male, I'm showing you the Italy, which was one of the hardest hit countries in the world. One of the reasons why they have such a high mortality is because they have a much older population, yeah. In South Africa, here on the right, we have a much younger population, yeah, which it's probably one of the reasons why our case fatality ratio and the number of deaths has not been as severe as Italy. But if you are not careful and this virus keeps spreading very fastly, yeah, we will catch them even with a younger population. Yeah. Just some scientific facts. At the moment, we have no evidence that this new variant of SARS-CoV-2, the 501.V2, cause more disease, and especially on young people. Another question that I was asked to answer, it is about the difference between the number of deaths and excess deaths. And here is where we get really worried. South Africa only have recorded 30,000 deaths, but we have close 83,000 excess deaths. And these deaths is coming from mostly from COVID, because when that's well recorded, but also sometimes from people not being able to access medical care in the middle of a pandemic. And as you see in this graphic, our excess deaths are much higher than the first wave and seems still to be increasing. So one thing just to highlight that's very important, is what you call the clinical severity of illness. What it means. It means that the majority of people that get infected will be asymptomatic or mild illness, and the minority will be either severe disease or critical illness. And that's where we worry. We worry about both of these groups. The mild and asymptomatic, they're gonna be major transmitters, and I'm gonna highlight information. And the severe disease and critical illness will cause major mortality. Why people die of COVID-19? Okay, they die of COVID-19 because the virus enters a cell in the human body that will infect the lungs, and then over time will basically destroy the lungs. That's the black marks in the lungs here as X-rays. And then once you have the lungs that stop working properly, what you get is an acute respiratory distress symptoms that the person cannot breathe. And one of the main things that we know is that humans, we can spend weeks without food. We can spend days without water, but we cannot spend more than minutes without air and without oxygen. And that's why it's so important as a response to what we call oxygen, provide oxygen to patients, and in severe case, to make it breathe from them, what you call mechanical ventilation. So what's happened in the disease? The first thing, just to make very clear, it has nothing to do with 5G. It has to do with a virus that infects the lung. And we can separate people in two different categories, what we call the survivors and the non-survivors. And what it happens is that normally both of them, it lasts around 20 days, which normally start here on the top with fever, one develop a cough, dysnopia, this means one starts getting a lack of air, and then one can be admitted to ICU, and then also you have a response from the body of the cortisol, What's the big difference from the people that survive and not? Because they develop a much serious problem with lack of air. And if they are not admitted to ICU and needed increased ventilation, they will first develop acute cardiac injury. This means the heart will stop working well. They're going to start failing the kidneys. They start secondary infections, and they end up dying. And that in a very fast time, 20 days. And how many of us know people that were looking good in the next month, they have gone, yeah? One important question also that there is a very strong misconception in South Africa is that woman is more infected than man. And not only more infected, that women would die more than men from this disease. And it's exactly the opposite, yeah? Men will have a consistent association in data in South Africa and around the world to be between 20 and 45% more likely to die from the disease than women. Yeah. Why that? A lot of time is related from men taking less care of their health. A lot of time is smoking, or most often also men try to be brave. In South not to be infected, but here is data from the national database. That's a database run by the NICD that show the same. Males is approximately 50% higher risk of death after adjustment for age and comorbidities. Yeah. So I'm getting just close to wrap my presentation, but let me explain to you that this virus do not only cause problem in the lungs, yeah, and that's why we have to really try to avoid transmission and infection. It also creates problem in the brain with serious neurological effect on the kidneys, on the liver, on the bowels, and also on the heart, yeah. So this virus is what you call a systemic virus that will cause major infection in the lung, but will start with spreading around the body and causing disease and infection in other organs of the body. How this virus is transmitted? It's not by cell phone tower. It is about people transmitting to other people, yeah? And they transmit that by either close proximity, and that's when you call like sneeze, talk, breathe, singing is a very big transmitter, yeah? Or by the virus, or what you call fomites, falling surface, and people putting their hand and then infecting them by the mouth, yeah? So we have these two different exposure, high risk exposure, very close contact in a closed environment. If one improve the ventilation by open window, one move from high exposure to low exposure risk. So sometimes some simple interventions can make such a difference. In simple intervention, if one use a mask, yeah, it is much less aerosol transmission, or if one clean the surface, yeah. Another important thing to highlight, this kind of transmission by pathogens, by influenza, yeah. Someone.
Sorry, Prof. But just to let people know, we are competing with a little bit of a thunderstorm and heavy rain. I'm not sure if that's having an impact. But let's try again. Technical team, we do your best. Prof, I'm not sure if you can hear us.
No.
Okay, shall we perhaps pause and maybe give Prof a chance later to wrap up? Seems to be a persistent technical challenge. Give me a fine. Yeah. Okay. Prof, if you can hear us, we'll just pause there, and then once the connectivity with you is better, we'll give you an opportunity to wrap up. But clearly already your message is quite clear as to what causes it and what we should not be doing and what we should be doing. And but we definitely will give Prof a chance to wrap up after the next presentation. Let us then move to the next presentation, and we are quite delighted to have the Vice Chancellor of the University of Johannesburg, Professor Chilidzi Marwala. Prof, I'm not sure if you are connected. I think you are.
Yes, I am connected.
Thank you. Prof, if somebody can phone Prof. De Oliveira just to give him a heads up as to what's happening. It's possible that he cannot hear us. And then we can hand over to Professor Chilidzi Marwala, the Vice Chancellor of the University of Johannesburg. Prof, again, it's an honor to have you, and I'll hand over to you and invite you to make your presentation.
Honorable Premier, Mr. Sihle Zikalala, Honorable MEC Ravi Pillay, Ms. Ellenson, CEO of Moses Kotane Institute, and Professor De Oliveira from the University of KwaZulu-Natal. I am actually quite excited to be talking to you today about 5G and its relationship with COVID-19. As the COVID-19, I hope everybody can see my presentation. Can you all see my presentation?
Yes,
As
yes.
the coronavirus engulfed the globe last year, we were faced with an unknown entity. Despite great concern amid the first members of the virus, we could not have predicted the sheer devastation that will soon unfold. As we continue to battle this invisible threat, it is a natural human response to want to place the blame somewhere else. Coincidentally, as our global order was disrupted by the virus, we have also faced a digital transformation at a scale unlike anything we've ever seen before. Naturally, the conclusion many have drawn is that the two, 5G and COVID-19, are linked. Of course, this is a wrong conclusion. As John Cook, an expert on the misinformation from George Mason University Center for Climate Change Communication, was quoted in the Washington Post saying, and I quote, a calamitous event like the pandemic creates a very fertile breeding ground for conspiracy theories, close quote. This is undoubtedly the consequence of a threat scientists are unraveling as it unfolds in the era of social media. There's been an onslaught of information, and with it, great misinformation. Despite our brains being complex and finely tuned engines, a fatal flaw of human beings is that we make snap judgments. We are by no means perfectly rational, and so often when we make decisions or draw conclusions, we are prone to human behavioral characteristics such as anchoring, loss aversion, availability, and framing. Anchoring is the psychological bias where people use irrelevant information presented to make decisions. For example, if I were to ask a room full of people who did not know our late leader, Mr. Chris Hani, and asked whether he died when he was younger or older than 40, and then follow this question with another question, which is, what age did Mr. Chris Hani die? Many people would likely give an answer that is close to 40 because of the information I gave initially. I gave 40 initially, despite the fact that Chris Hani actually died at the age of 50. In his book, Thinking Fast and Slow, Dan Kahneman described the phenomena of anchoring bias. As he explains, anchoring works best if the person involved knows very little about the subject. The coronavirus, of course, is a prime example of this anchoring problem. Added to this, human beings often reach conclusions based on the information that is available to them and based on how they would frame an issue. And the information that is available, especially when you go to the dark side of the media, is that 5G causes a coronavirus. Admittedly, there is a great unknowns about the virus. We have learned about this virus as we have combated it. We have seen how symptoms manifest differently on people and how some do not display any symptoms at all. In recent months, the virus has mutated into new strains, as the professor had indicated. Of course, alongside this, we have been inundated with information, including conspiracies. As a result, it is often easy to believe conspiracy theories because we feel so out of control and so left in the dark. As Cook tells us, and I quote again, somewhat counterintuitively, it gives people more sense of control to imagine that rather than random things happening, they are these shadowy groups and agencies that are controlling it. Randomness is very discomforting to people, close quote. As the coronavirus unfolded across the globe, the conclusion drawn by conspiracy theorists is that 5G is linked to the coronavirus. Some have argued that the coronavirus is a myth and is being used to cover the impact of 5G on people. Others have argued that 5G impairs people's immune systems, making them more susceptible to the coronavirus. The claims of conspiracy theorists have moved into the mainstream and worryingly have been fueled by celebrities. There were warnings from tennis player Novak Djokovic and his wife. There were tweets from singer MIA and actor John Cusack. There were Instagram posts from actor Woody Harrelson and an Instagram live from music producer Teddy Riley. There were Facebook posts from African pastor Chris Oyakhilome. What is important to note here is that these celebrities are not scientists. None of them are doctors. None of them are authorities on COVID-19. So where did this conspiracy emerge from? While it is difficult to track the exact source, conclusions were drawn in large because of timing. In 2019, the first cases of the coronavirus were recorded in Asia. Unrelated to this, 5G was deployed globally in 2019, and towers were being built to support this technology. This phenomenon is called correlation. But as the famous adage goes, correlation does not mean causation. Correlation means there is a similar pattern or relationship. In this case, we can trace both back to 2019. It's just a coincidence that 5G was launched in 2019 and COVID came in 2019. Causation takes this one step further. It means that one event causes another event to occur. And in this case, no such causality existed. In other words, just because something happens at the same time, such as the coronavirus spreading and 5G towers being built, it does not mean that 5G is causing the virus. But let us look at the science. COVID is a virus that is transmitted through respiratory droplets and spreads similarly to the flu. It is a living organism. This, of course, is why it is so crucial to wear masks as it covers your nose and mouth, reducing the possibility of spreading the virus should you have it. A coronavirus is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. Though we have not seen this strain of coronavirus before, there have been other strains in recent history, as the professor has indicated. For instance, the SARS outbreak between 2002 and 2004 was a form of the coronavirus, as was the MERS outbreak in 2012. COVID-19 spreads the same way other coronaviruses do, mainly through person-to-person contact. Infections range from mild to deadly, naturally based on the science. The logical conclusion we can draw is that 5G cannot cause COVID-19. Why is this so? 5G is simply put the 5th generation technology for cellular networks, which is a progression of our current technologies as societies increasingly go mobile and consume more data. In order to understand 5G, we need to understand spectrum, which is about frequency. All of this communication is done using electromagnetic waves because they unite magnetic forces and electrical forces. This unity of magnetic forces and electrical forces is exactly what ESCOM uses to generate electricity. For those of you who are old enough to still remember a dynamo of a bicycle that makes the electric light go on, you will, when you move, you have something that is rotating around a magnet. Whenever you have a magnet, there is electricity. Wherever you have electricity, there is a magnet. So if you have a wire that is carrying electricity and you take a magnetometer, you will realize that it shows that there is a magnetic field. So this is what electromagnetism is all about. And the waves, the electromagnetic waves, are the ones that we use to communicate with our cellular phones. So simply put, and what is this thing called frequency? Imagine if you are on a beach somewhere in Durban and you see a wave coming. The frequency is the number of waves that pass a particular point in 1 second. In this scenario, if 5 waves pass a particular point in 1 second, we refer this as 5 hertz. We use the term hertz because the person who proved the existence of electromagnetic waves was Heinrich Rudolf Hertz, a German physicist. So the length of the wave is called a wavelength. And we'll talk more about the wavelength and whether a wavelength of the 5G is dangerous or not. So if you multiply a wavelength, which is the length of the wave, by the frequency, you get the speed. Of course, if it is the wave in Durban, the speed will be slow, but for electromagnetic waves, it travels at the speed of light, which means it can be able to go around the world in a fraction of a second. So, if the frequency is high, then the length of the wave is short. If the length of the wave is high, then the frequency will be low. So, for example, in our radio, we use low frequencies, for example, to listen to Ukhozi FM. The reason because the frequencies are low, it means the wavelengths are high, and therefore we can listen to Ukhozi FM without having to have transmitters in every village. It has to do with the length of the wave. So why is this explanation necessary? This explanation is necessary because it starts telling us the safety of the waves that we are dealing with. So here is an example of an electromagnetic spectrum. So here is visible light. This is the light that you get from when you look outside your room when it is sunny. That is visible light. It is here. Here you have what is called ionizing radiation. This becomes a dangerous type of waves. They are very high frequencies. Of course, we control them and we use them. For example, X-rays, we use them in hospitals in order to see what is inside our bodies. Many of us have gone to hospitals and we have been told to go and take an X-ray image. Gamma ray images are used in hospitals. Sometimes with advanced forms of cancers, you go to gamma ray imaging because it is able to reveal more information than others. A large exposure to gamma rays and X-rays is actually not good. Then you have, so these are short wavelengths. Then radio waves. This is where our phones operate. The waves that we use for us to be able to communicate are somewhere here. Of course, because they are all radio waves. So whether it is 1G, whether it is 2G, 3G, 4G, 5G, doesn't matter. These are electromagnetic radio waves. So of course, 5G will come a little bit higher. Now, here, the radiation that comes out of that is called ionizing radiation. So it is dangerous if you have exposure. So here where 5G is not ionizing radiation. And this is an example, gamma rays, ionizing radiation, microwaves. In fact, 5G starts operating here, and so on and so forth. So, why is this explanation necessary? As explained earlier, COVID-19 is not spread by radiation, but by a virus that is passed via droplets from person to person. In fact, the World Health Organization says no research has linked exposure to wireless technology with any negative health effects. However, it is still important to understand this technology, even if we debunk conspiracy theories. As we move into the fourth industrial revolution, it is important that we embrace technologies such as 5G. In South Africa, mobile network operators Vodacom, MTN, and Rain have in recent months started to deploy commercial 5G networks in some parts of the country. However, to understand 5G technology, one must understand previous technologies. As I have already said, 1G, you could only communicate with voice. And the first 1G was analog, which means it was not using ones and zeros. Whenever you are using a computer, the computer only, or a phone, it only understands ones and zeros. Then we had 2G, voice and SMS, it became digital. Then we have, and you still remember when we were 2G, we used to have GPRS network. Then we are in 3G, and as you move up, it becomes faster and faster. In 3G, you could now access internet, and you could download 144 kilobytes per second. That is small. It's not bad, but it's, you know. Now with 4G, and 4G is LTE on your phone. When it is written LTE, it means it is 4G. You can be able to download 300 megabytes per second. And now, after 2019, we have 5G. AT&T has achieved a speed of 1.8 gigabytes per second. Means you can download almost 2 gigabytes per second. That is huge amounts of data. So it is important that we invest in this technology. Otherwise, we are going to move at a snail pace while navigating the internet, and it will have impact on businesses, and ultimately it will have impact on the state of our economy. So, for us to be able to do all these things, we need spectrum. So spectrum is that frequency. Now the difference between the frequency that is given to MTN and the frequency that is given to Ukhozi FM is that Ukhozi FM is given one frequency. That is why they will tell you that you have to tune to 100 megahertz and so on and so forth. Whereas for telecommunication companies, you need a frequency bandwidth, which means it operates from one frequency to another in between, so that you can have two-way communications and you can be able to deal with the technologies that will avoid interference. So this spectrum is actually given out by an organization called ICASA. Last year, ICASA issued a notice that they are going to be going to the market, and those who are interested to bid for this spectrum must do so. We know obviously that Telkom is stopping the process because it is saying that this spectrum must be distributed in a way that is advantageous to all. So 5G is not merely a marketing tool for telecommunications companies to stay competitive. We're increasingly going mobile and consuming more data. I can now bank, reply to emails, and Google the latest on 5G in a matter of seconds. Yet the current broadband spectrum is also becoming increasingly congested and simply cannot keep up with the demand. Take load shedding, for example. As more people in the same area try to access online mobile services, at the same time, there are gaps in the connectivity. At concerts, you may struggle to upload a video to Facebook or Instagram, or even send out a simple WhatsApp because everyone in a stadium is trying to do the same. 5G is much more effective in handling thousands of devices simultaneously because it has bigger bandwidth. This does not merely encompass mobile devices either, but includes video cameras and smart street lights, for instance. Because 5G has a relatively small wavelength, because it has higher frequency and shorter wavelength, it means we have to bring transmitters closer to our homes. So instead of a village having one MTN tower, you are going to see more towers, almost the same as we have for electricity that comes to our homes. And that does not necessarily mean that it brings with it danger, as I've already indicated. So each generation of wireless standard, or G, has had an increase in data carrying capacity. So it is all about our ability to handle more and more data. So coming to the conclusion, what is to be done going forward? Let us use science to draw conclusions. Let us rely on science to draw conclusions. Let us not rely on people who are neither scientists or doctors to be able to tell us something as important as the linkage between COVID-19 and 5G. Let us educate ourselves on technology. Illiteracy today is no longer just the ability to read and write. There is something called technologic illiteracy. And I think let us create further training programs to retrain people who are not trained in these technologies. Let us make these technologies more accessible. You don't need to be a mathematician to understand what 5G is all about and what it can do to your work or to your business. Let us educate ourselves about other technology, artificial intelligence, blockchain, because these are the technologies that if we understand, we can be able to use in order to expand our economic activity. Of course, let us protect ourselves from COVID-19 by doing all those things that Dr. Nkosazana Dlamini Zuma has advised us, and Dr. Kize has also advised us. It's not 5G, is what we do. Social distancing, avoiding crowds, wearing masks. Those are the things that we are supposed to concentrate on in order to deal with the issue of COVID-19, not to go and destroy 5G towers. I've already indicated, let us release the spectrum to enable 5G. 5G is only going to come if we have more spectrum. What we decided to do, and this was 15 years ago, was that we are going to release the spectrum that is occupied by SABC by digitizing our broadcasting. Of course, we know about set-top boxes, and 15 years later, we still have not digitized SABC, and the spectrum that we could have released by digitizing is still locked. Let's do these things. And in conclusion, 5G does not cause COVID-19. So, I hope this has painted a clear picture of what we are facing. The theoretical physicist Brian Greene put it best when he said, science is a way of life. Science is a perspective. Science is the process that takes us from confusion to understanding in a manner that is precise, predictable, and reliable. A transformation for those lucky enough to experience it. That is empowering and emotional. If you really want to get more of this, there are two books, Closing the Gap in the Fourth Industrial Revolution. You can get it from Exclusive Books, and Leading in the 21st Century, which deals with issues of 5G and what we can do with it. We are in the process of translating Closing the Gap into our indigenous languages. We'll start with isiZulu so that we can make these technologies accessible to our people.
Thank you very much, Professor, for that crystal clear presentation. I think I think it was very clear, and I think we don't begrudge you that marketing opportunity for the book, and I certainly will try to buy it. And I think some of the takeaways are that celebrities are not scientists. Celebrities are not scientists. Correlation is not causation. Right? I think we're learning correlation is not causation. Premier, the fact that I started smoking for the second time when you became Premier doesn't mean that you caused it. We've learned about wavelength and frequency, and that it's important to invest in technology. I think we've become to understand how ICASA works, and that there's a legal framework that guides how they do their work. And it says, the Prof says, let us use science to draw conclusions, and emphatically that 5G does not cause COVID-19. Prof, thank you very much. It's really empowered us. And as we said, this is just the beginning of the campaign. You are training us, you are arming us, you are empowering us to take this message to every corner of our province and, of course, our country if necessary. Thank you very much. Colleagues, we now need to move, and I'll just make an appeal. Okay, firstly, let me just report that unfortunately Professor de Oliveira could not come back because he started a television live interview at 6 p.m. But let me take this opportunity, and we will do so in writing, I'm sure, thank him for his presentation and contribution, which is also empowering from the virologist perspective. Now, very quickly, colleagues, if I can ask the team that's dealing with the next item, I think Professor Marwala will be part of that, but we'll start with Sandy Mashlala from Microsoft, and he'll be assisted by Ismail Martinia from Vodacom, and they're going to give us a quick helicopter view of the results of a survey they did. What are the perceptions out there? You know, they went out and asked questions and see what are ordinary people saying and thinking, and then we'll have brief responses by each of those three persons. So Sandila, I think you are starting. Can I hand over to you?
Thank you very much, MSC. I'm just going to start my presentation. I will do like Tandeka because all the other speakers, chairperson, were speaking in English. I will just use the vernacular for this particular presentation. So, oqala nje ngifuna ukusho ukuthi bekukhona amathuluzi amabili esiwasebenzisayo chairperson, on this particular part. Firstly, besebenzisa ukuthi sibheke using the link esayisenda ku-Facebook nawo wonke ama-social media ukuthi abantu bathini ngezimvo zabo. Okwesibili, besilalele kwezokuxhumana, silalele ku-Twitter, salalela naku-Facebook, salalela naku-Instagram ukuthi abantu bakhuluma bathini uma bebona ama-poster, zishintsha kanjani izimvo uma bebona yonke i-information ebeyade ihambiswa ngaphandle ngendlela zama-poster nangendlela zokuphendulana uma kuphendulana kwezokuxhumana. Sengizoshaya nje ngamafuphi-ke chairperson, kulawa aformal, kusho ukuthi lawa yilawa bebephendula kuma-forms, yilokhu sisanakho kwamanje. Iyaqhubeka le survey, ayimile ndawonye, sisazoyiphusha njalo njalo ukuthi sikwazi ukuthola even honorable premier ukuthi how such things are changing the perception and ukuthi abantu babhilivela kuphi and bashintsha kanjani. Uyabona nje ukuthi eThekwini ihambe phambili kakhulu ngoba yiyo ebeyade ihamba ngezimvo eziningi ezihlukahlukene. Sibe sayihlukanisa ngokobulili ukuthi ubulili bebumi kanjani phakathi kwalaba besilisa nabesifazane. Okumnandi ngingareporta honorable premier and MEC president ukuthi into esiyenze ngayo beyibhala ngesingisi ibhala ngesizulu ukuze abantu bakwazi ukuthi baphendule ngoba bekwazi ukubona abakubonayo. Siyabona nje ukuthi la ngokweminyaka laba abantu abaphakathi neminyaka impela i-high i-response sibe nayo kule ebesiyenza formally. Ngifuna nje ukucacisa njalo ukuthi le formally lapho abantu bephendula imibuzo ebibuziwe. Imibuzo ebibuziwe ibuya kade iwu-5. Yiyo nje isummary yakhona le, ngizobuka isummary kuqala ukuthi ngingasho la honorable premier mangibuka nje indlela ebalance ngayo abantu bakwaZulu Natal abaphendulile from lama district adevetting. Cha, baya-understanda ukuthi 5G akuyona eyenza isifo secorona. Kukhona nje i-understanding enhle. Uma ubuka kahle honorable premier and MECs in this particular part abantu abalalela, uyabona nje ukuthi eThekwini iyodwa abantu abashoyo ukuthi cha, i-5G ayi-transmit i-COVID bangaphezulu kakhulu even kwa-70% kwabantu abaphendulile ukuthi cha baya-understand. Uyabona nje nama-total azisho la ukuthi there is a clear understanding ukuthi cha, ayikho i-association ye-5G kanye ne-COVID. Kuyasiza lokhu kakhulu ngoba kwenza ukuthi kube lula ukuthi masikhuluma nabantu baqale babone ukuthi cha, lesifo kukhulunywa ngaso kanje kuma-social media kodwa thina njengabantu ey'ndaweni ezihlukene kuma-district ethu siyabona ukuthi akuxhumene lobumba kanye nala 5G kukhulunywa ngayo. Siyazama-ke nje ngiyakutshengisa nala ukuthi nama-tower again bayasho ukuthi cha, abayiboni i-harmful i-tower. So uyabona again ngendlela expresseke ngayo ukuthi cha, akukho ukuxhumana kokuba harmful kule particular ne-health yabo. Mase kuthi khona bi-direct ebibuzayo ukuthi cha, does i-5G cause i-COVID? Again nala uyabona ukuthi kukhona kona ukutshengisa ukuthi abantu bathi cha, khona abanganayo ishoka ngoba ublank ushudele abaphendulanga. Mase bakhona abanye abame ndawonye abasaqala ukubhilivela khona. Kusho kufanele kube khona umsebenzi onzima okuye siye phansi kubantwini sihambe imigwaqo ngemigwaqo ema-district sifundise nje nge-technology, sifundise nangakuthi kwenzeka kanjani uma kuthi kukhona ezokuxhumana, uma kukhona isifo sihlukanise ne-technology, nezokuxhumana. Mase yilenye again beyade sisibuka nje phansi ngendlela ehlukene ukuthi kwazi ukuverifya indlela abaphendule ngayo abantu. Okugcina-ke nje yiwo nje lo obode ade ubuza nje a little bit about ukuthi ikhona yini ukwazi noku-understanda ukuthi lesifo sithelelana umuntu nomuntu. Nakhona lana uyabona ukuthi baningi abaziyo abakubonayo lokho okukuhle kakhulu la ku-true. Kodwa khona lo 170 mase bakhona 338 esisadinga ukufundisa more sikwazi ukutshengisa ukuthi kuhamba kanjani lezinto lezi. Kukhona-ke enye survey eraniwe le biranela ukuthi sikwazi ukubona ukuthi kwezokuxhumana kuhamba kanjani and nanokuthi abantu bathini ngalokhu nalokhu. Isaqala-ke isasebenza kwamanje and iyasetshenziswa ukuthi nje sikwazi ukumonitha ukuthi kuhamba kanjani, kuqhubeka kanjani. Uzobona nje masibuka sonke kukhona indawo ka-Facebook la sithatha amagama abathile abantu abawashoyo ku-Facebook sikwazi ukubheka ukuthi kuthiwani ngale particular ngendaba ye-5G iKwaZulu Natal, inkulumo ekhulunywa uPremier, sihlanganise konke sibheke ngokusebenzisa i-artificial intelligence ekethi into Professor Eli ukuthi is that becoming a negative or natural, a kind of neutral conversation, or is it positive? Okwamanje mawubuka isurvey yethu ubonile nalapha bisho ukuthi there is a lot of people abasamancika sometimes masikhuluma sibeka lokhu okunye okukhona la sisazokusafisa kahle size sure ukuthi siyagada ukuthi sikhuluma nge-5G ne-COVID kuphela akukho okunye okusuke kuthathwe it's our algorithm ukuthi ifane ngendlela ehlukene sikwenze okufana nange-Twitter siyayidonsa yonke imibono yabantu and very soon so wazi even ukubona labantu bakhuluma kephi bakhuluma ngani mabe-Twitter ukuze sikwazi ukutshengisa again kule mfanekiso ukuthi abantu bathini nabantu bacabangani ukuze sikwazi ukuqala isitarget ukuthi sikwazi kanjani ukukhuluma nabantu ekubafundiseleni. So konke lokhu kwama-effort esihlanganisa i-technology kuwona sihlanganisa imfundo esiyibonile ku-social media sihlanganisa ukuthi abantu bathini ukuze siqale sikwazi ukuthi masiqhubeka ngale campaign njengoba u-chairperson was explaining, this is a start. We know how to target people correctly, how to have a conversation with them, and how to ensure that we kind of change the way they think in way of educating them and being able to do the part. I will hand over to now Ishmael from Vodacom just to give a perspective in terms of some of the things that are actually surrounding the way they are rolling out technology and some of the regulationary part on it, which I think Prof touched very nicely when he was speaking during this part. I don't know if I can hand over to you, Gege Ishmael, to continue from here. Thank you.
Thank you, Mr. Mhlaba. Greetings to Honorable Premier Sike Zikalala, CEO, Mrs. Kotane, Ms. Vincent, and Mrs. Honorable Ravi Pillay, Ms. Melanie Zulu, Prof. Marwala, Prof. Defiles, and in our presence as well, Chris Lazarus, Kazren, and importantly to also acknowledge Thabiso Tukano, who is the Managing Executive for Public Affairs from the National Office in Vodacom, and certainly all protocol observed. As my colleague has mentioned, I'm going to talk about two very distinctive issues, just expanding on what Ms. Ellison has mentioned and equally Mr. Matlaba. The first is what Prof. Marwala has deliberated on in detail. However, I'll take more of a practical application or stance, which operators in the telecommunication industry are legally obligated to adhere to. So in any event that a base station is brought up or is commissioned, right, this also applies to any upgrades, it be we're doing a 2G to a 3G upgrade, or we're doing a 4G of recent, of course, to a 5G upgrade, where any other infrastructure or any radiation pattern has been, it will have or has changed. We are obligated by an independent institution for us to make sure that we do an independent radiation assessment on this particular site. This is conducted by an independent organization. So in other words, you are not referring to an organization that has any affiliation to any of the operators in the telecom industry. And in any event that there is any non-conformance to any prescribed guidelines, the said operator is expected to correct as urgently as possible. So that is the first part from a practical or best practice perspective. And of course, alleviating any fears that there might be any radiation issues, we are expected to oblige to those guidelines which I have referred to. And the second one is just a bit of a synopsis, on how the data usage trend has changed following the lockdown and the reliance on network infrastructure, and specifically mobile network infrastructure, and more so now with the lockdown. And I'll share some of the insights and observations, particularly now during the lockdown, given the reliance on the mobile network, as I have mentioned, where customers or consumers are relying entirely into the network infrastructure for them to do their day-to-day activities. This also include, of course, SMMEs, but a simple call, from any in our communities. Now, our stance, and very aligned to the 4 IR, key objective, which is central around digital inclusivity. We have embarked into what we refer to as a broadband expansion program, which is aimed at bridging the digital divide, meaning between the rural and the urban. And this is a combination of a very intentional network expansion program called the Deep Rural Program, which is aimed at the densification of the network, particularly in rural areas, and also the provision of mobile connectivity, in areas which were not previously served. Thus, the product of the two has resulted into specifically LTE coverage doubling over the past 2 years to just over 94% in the context of KZN Vodcom, certainly, an indicative of the presentation that was shared by Ms. Ellison. And the second one is that in the more rural segment, we have seen LTE literally tripling, and that a combination of 3G and 4G broadband connectivity is in the order of more than 99%. And of course, this talks to our stance and commitment of ensuring that we make broadband connectivity an essential and basic, less of a need to our customers. Now, it is due to this commitment, that even with the 40% data traffic explosion that we saw, or a growth with the lockdown, when it was instituted, and a movement of citizens, moving more to residential areas and more to rural areas, yet the reliance on mobile connectivity is still been there, that we managed to cope with the higher traffic demand. In other ways, customers now, doing more data-related services, relying on the network, to do their day-to-day activities, as I have mentioned earlier on. And just in conclusion, and this is an indication again of the reliance on mobile connectivity, which essentially is a basic need or requirement, unlike in the past, where there was less reliance in terms of just carrying on from a day to the other. As such, objective, to guarantee access to network as operators at all times. As such, the events which unfolded in the past few days, of which all technologies unfortunately were affected on some of those base stations which have been impacted in the past few days, and leaving the citizens out of connectivity is very, very unfortunate. And this, of course, brings its own complexity, in relation to the broader objective as outlined, insofar as what we are aiming to achieve as operators, and more so in our objective of embracing this digital inclusivity via the 4R vehicle, which I have referred to. Thank you.
Thank you very much, Ishmael, for that. Prof, we are running a little bit behind time, so can I just give you 2 minutes to comment on that, those perception statistics that were given? I'm not sure how the sample was done. On face value, it's a little bit of concern as to the extent of the work that we have to do. But over to you, Prof. 2 minutes. I'm sorry I have to limit you because you're slightly behind schedule.
No. Thank you very much. I think I have to congratulate the province under the leadership of Premier Zikalala for actually going to collect the data. Data should be the source of our decision making, and we can argue about the statistical characteristics of the conclusion, but I think it is a very important initiative, and I would really be looking forward to seeing the perceptions, whether we can localize them so that we can know what needs to be done where. Thank you very much.
Thank you very much, Prof. You've given us an additional task to engage in further work. That's part of taking a scientific approach to things. Colleagues, we can then move to the main item, or the pre-main item, and it's my pleasure to ask the MEC Health, MEC Simulane Zulu, to just make a few remarks and then introduce our Premier, who's the keynote speaker.
Thank you very much, MEC Pillay. Good evening to the Premier. Good evening to yourself, colleagues, everyone who is joining us on this webinar. We really appreciate the opportunity. As you clearly indicated, we are running a bit out of time, so I will try and be very short. The first point I think that we need to appreciate is the leadership of the Premier, who, after understanding that we are faced with this situation where there's quite a lot of myths and misinformation that is going around, took a deliberate decision that the provincial government, of course led by the Premier, will embark on a campaign that ensures that our people are given proper information, and you can only do that by ensuring that the experts and those that are in the know on the subject matter are giving proper information. And I think that is what we have actually listened to today. the issue of networks for the Department of Health in particular is extremely important because our facilities, both at the level of hospitals and the primary healthcare facilities, needs a progressive and a capable network for us to be able to improve the level of care that we are providing to our people. So it is very important that we get this network, and it's important that we improve on it because it will also improve our connectivity in rural areas as well. And that is where we have the biggest challenge as the province of KwaZulu-Natal. And when these towers are taken down, that doesn't just affect the network in terms of communication, but it also affects the network in terms of service that is being provided to our people. Today, Premier, I visited the 2 hospitals that are in rural areas. One is Montobel and the second one is Apesbosch Hospital. And that is the fact that they indicated when I got and I met with the management, is the fact that the network is now giving them problems, and therefore they are unable to provide a service that they should be providing. That is just one practical element of it. But we are also aware that seeing the dire consequences that... Oh, sorry, I've been asked to open the camera. Okay. Thank you. I was saying that we've also, as a consequence, or as one of the consequences of this is misinformation that we are seeing out there, is that the myths are creating a serious worry amongst our people. And one of the challenges of this worry is that our people are beginning to present late to our facilities because these the voice notes and the information that's going out there about 5G has then made some people not take the government call seriously of presenting on time and ensuring that they come to health facilities for whatever assistance that they need. As a result, Premier, we see that some of the deaths are caused by late presentation and could have been dealt with, or those are lives that could have been saved have they had an opportunity to come earlier to our facilities. So we think this opportunity, we thank this opportunity that you have given us, and we really appreciate that you, as the leader of the province of KwaZulu-Natal, has taken the matter of talking to our people about the 3G and COVID extremely seriously. Ladies and gentlemen, I wish to present to you the Premier of KwaZulu-Natal. All of us know him. He was a member of the Executive Council in the previous term, responsible for economic development, and he is now the Premier in the province. Can we then please welcome Premier Zikalala to talk to us about 5G, the myths and misconceptions. Thank you, Premier. Over to you.
No, thank you. Our program directors, MEC for Economic Development, Tourism, Environmental Affairs, MEC Ravi Pillay, MEC for Health, MEC Nomakukus Milane Zulu, our distinguished speakers and presenters, and we wish to applaud and thank you for providing such an information to us. Professor Mawala from University of Johannesburg, the Vice Chancellor, thank you for sharing with us such detailed information on 5G. Also, Professor De Oliveira from UKZN, as well as Tandega Ellenson, CEO of Moses Kotane, the Deputy Director General, Mr. Pega, CEOs who are here and colleagues from government. We take this opportunity to thank all people of our beautiful province and the country who have joined us in this critical online engagement, where we explore facts about the effect of 5G technology on the deadly pandemic of COVID-19. I wish to pay special tribute to our eminent speakers for having responded positively to our invitation and join us as government in exploring this subject and to continue to empower us so that we can be able to clarify the matters to the people of KwaZulu-Natal and our country. Let me also applaud the participation of the private sector, the network providers, the entrepreneurs who are here, especially those who represent small businesses who are with us here and those connected. As government, we are heartened to see ordinary South Africans, the private sector, the civil society, and government agencies uniting, rising and entering into a meaningful dialogue that seek to overcome the dangerous misconception about 5G technology. This dialogue attests to the fact that a vulnerable society and a state of disparity that holds sway can manipulate the environment for the benefit of any opportunist. The current state of disillusionment caused by poverty and unemployment in particular gives space for misinformation, which sometimes fuel unguided mobilization, even against the noble or progressive agenda. It is clear to us that to win the battle against the disinformation, we must ensure that such occasions and platforms are not a once-off event. We must all agree that we are launching an important campaign which must involve all stakeholders and be sustained into the future until our province obliterate all challenges that we're facing. Any development, in particular the industrial development, is highly dependent on physical and the soft infrastructure. By physical infrastructure, I refer to roads, bridges, ports, and others, while soft infrastructure will represent telecommunication, network facilities, and others. There is sufficient evidence that the most of undeveloped countries with less infrastructure struggles to assure economic development. None will ever invest, and no one will invest in an area with no roads or no proper telecommunication network. The same obtain, in fact, rendering social services requires telecommunication, calling an ambulance, reporting crime to the police station, providing electricity, and even providing education. Today, all of these requires telecommunication services. Evidently, countries with advanced technological connectivity yield better living conditions and better positioned for economic prosperity. For our province and our country's development, we all need to unite against those who are hell-bent to steal the future of our children by their unacceptable and irresponsible actions. South Africa is recognized in Africa and in the world as one of the industrial areas that is industrialized. It is also said that it stands better chance to yield more investment, and that is because of both physical infrastructure, our roads and ports development, and that is because of telecommunication system. Whether you will talk of banking facilities, you will talk of telecommunication services, the softwares that are provided. And all of these are dependent on technology, which include these generations, whether 3G, 4G, and 5G. Now, what we witnessed early today when we inspected some of the infrastructure at Tuka High School and eThekwini Primary in Wamashu, tells us that we need to do more to educate ourselves and our people about the effect of these services. At the end of last year, we gathered at Kwame's place in Umlazi, where we launched this critical communication and development infrastructure. And as we celebrated this milestone, we also explained the benefit of this infrastructure, in particular, why we had to prioritize our townships and rural areas to accelerate poor development. And today we heard from Professor De Oliveira and Professor Mawala that there is absolutely no scientific evidence that 5G cell phone towers are harmful or cause COVID-19. And therefore, we must take this message, take the message to our homes, our schools, places of worship, taxis, train station, and all over, and explain that non-ionizing radiation as opposed to ionizing radiation found, for instance, in X-rays is not harmful, is harmless to humans. We must also share light that it is impossible for 5G technology or 3G or 4G to transmit the virus. We need to underline the fact that viruses cannot travel on radio waves or mobile networks. Anyone who tells us otherwise is not only reckless with our life, but also seek to arrest our development as the province and the country. Let me pause here and just, and I'm not trying to be funny or so. Many of us and many people who talk about 5G will not correlate the spread of COVID-19 and the 5G. In some areas, you find that COVID-19 is prevalent, but there is no technology. Now, we must be able to understand this. You will go to KwaZulu-Natal as a whole, and you get areas that have poor connectivity, let alone of the 5G. But those areas are seriously affected by COVID-19. And therefore, logically, we should be able to explain and understand this. I'm saying this because I want to emphasize the point that our scientists have raised, that the explanation from scientists, both those who specialize in technology and those who specialize in health, proves that this virus, COVID-19, is transmitted from human to human, and it cannot be an issue of a cell phone or anything of that nature. Secondly, the 5G technology is a progression and an evolution of an existing technology. And the colleagues who are here will know that I always speak about this issue. When you come and say you've got a computer, I will ask the first question whether it is compatible with your needs, and whether if you carry a computer, you then carry a modem to connect. And you find that most of people who will say, no, there is an effect of 5G. In fact, they have not reached that level of connecting to 5G. And I think we must understand destroying these towers is undermining progression. And I want to be clear on that. It is important that we understand this. But secondly, there are bodies in this country, there are structures that regulate. And no one will just come here and come with facilities that are dangerous to the people. The latest is the International Commission on Non-Ionizing Radiation Protection Guidelines. And that was issued in March this year. And that provides clear guidelines for mobile operators on what kind of network they can deploy in this country. Clear. So there are guidelines, they are regulated. I must therefore say it is crime to spread fake news or disinformation. When fake news is spread by a person who spread the fake news, he himself, if you engage with him as a person, you find that the substance on the subject matter is not at a level envisaged to argue. It becomes a problem. I'm not going to be detailed on these issues. So destroying technological or techno-communication infrastructure is a serious crime and punishable by law. But let me be clear. Kunezingamaqiniso kunalezingamanga. Ubuchwepheshe be-5G akulona iqiniso ukuthi busabalalisa i-COVID-19. I-COVID-19 isabalaliswa ngabantu ngokuthelelana. Yingakho umnyango wezempilo nabo bonke ososayensi emhlabeni bechaza ukuthi asigweme ukuthi sisondelane, masifake ama-mask, masiqinisekise ukuthi la sithinte khona izinto siwasha izandla ngamanzi nensipho osisebenzisa isanitizer. Akulona iqiniso ukuthi imbhoshongo ye-5G iyingozi empilweni. Abukho ubufakazi obuveza lokho. Kodwa iqiniso lithi le mbhoshongo ye-5G ikwenza kube lula kakhulu ukusebenzisa izinto zobuchwepheshe ezifana nama-cellphone nezifana nama-computers, zonke izinto ezisebenza ngama-network. And therefore kumele sikwazi ukukhuluma iqiniso linjengoba linjalo. The Minister of Communication, Minister Stella Ndabeni, recently put it, and she said, I quote, "The country currently needs resilient and high-speed connectivity for every citizen to be able or to enable themselves to participate meaningfully in the digital economy. Furthermore, mobile telephone is crucial in the fight against the coronavirus pandemic," close quote. So this is clear. And another fact that is very important here is the relationship between the network operators and communities. I think we must also underline this point, and that's where I think MEC Pillay, we must engage with the point that you are raising. The point that the survey, the sampling, I don't think we should be worried about the sampling, because the sampling tactic was issued and people responded. But what the sampling is affirming is the fact that people are scared and hesitant. And this is because network operators themselves, when they install and provide services, they don't build relationship and trust with communities. When we provide services to the people, let us work with them. Let us ensure that we go there before we meet with structures, introduce ourselves, but also meet with the communities. Let these big companies, whether we talk of Telkom, MTN, Vodacom, and Cell C, let them understand the conditions and the conditions on areas they are covering and operating. Let them be attached to communities and not just deploy towers and leave and think that someone must only protect that. Educate the people, work with the people, but also assist the communities. We're from KwaMashu, and Ms. Ellency will tell you here that in KwaMashu there is a community, there is a center there which was opened by Samsung. And when Samsung opened that center, they said, we are going to train young people from KwaMashu to repair our cell phones and to repair all our products in KwaMashu. And I think it will be ideal for MTN, from Cell C, for Telkom, Vodacom to say, councillors and lower structures, who are people here who are operating spaza shops, and we would want to work with them to sell our airtime, and this will be their benefit. And that is how we create partnerships. And that is how we make people to be with us. And this tendency of being aloof to the conditions sabotages a very good agenda. The agenda of digitalizing South Africa is noble, it is progressive. But if we do it above the people and leave the people, it will then be undermined. We need to go together as the society of South Africa and ensure that all people are with us. Want to emphasize the fact that from the 1G to 4G, Africa has lagged behind. And with the deployment of the 5G now, it is an opportunity that we should seize rather than undermine. And therefore, as we advance digitalization and innovation, we must also insist on localization and supporting manufacturing in our own country and ensure that technological services are available in rural areas and in townships. And that's why when we launched this 5G, we said we are inspired that it is launched in Mlazi, in a township that is the third biggest in South Africa. And the people of Mlazi must benefit from that, both from access to technology, but also small business must benefit. So our strategy as KwaZulu-Natal is to ensure that the province is digitalized, but as we digitalize the province, we move together with the people. The priority is to ensure that we have digital skills, and digitalizing people will therefore mean that we train in rural areas. The department under MEC Pillay is leading the establishment of digital hubs in deep rural areas such as Bedville, areas such as Mpofana, and other deep rural areas where we are building digital hubs where small business will have access to technological services they require, but also where students could go and conduct their research and studies. In rolling out the 5G, we must ensure transformation take place. We must empower people and ensure that it is on its own efficient and effective. As we conclude, we would want to emphasize there must be a distinction. The issue of the 5G is a struggle that we must wage together, and ensure access to technology in all areas of KwaZulu-Natal. On the side, the pandemic is an issue on its own. And I think Prof. Mawala put it correctly. The process of causality and correlation. The fact that the two emerge in the year 2019 and 2020 doesn't mean that one caused the other. And I think we must be clear on that. With regard to the current state of COVID-19, let us all understand this is the war. And in any war, there are two sides. In this regard, there is one side, and that side, it's a side of humanity. The global people, all of us, should be united. On the other side is the enemy, and the enemy is COVID-19. We have said that it is an invisible enemy which cannot be identified, but we must overcome it. We must defeat it. Let us not sidetrack each other. Let us not be detracted by misinformation. This misinformation will undermine our collective unity and will undermine our effort to conquer this pandemic. Let us be serious and let's understand that this is a deadly pandemic. It kills. Many of our people have died. Let us not be denial. There are many people who are denying the existence of AIDS. It took us time, and that cost us a lot. We cannot fall into the same trap. We are either together fighting the enemy, and the enemy is COVID-19. Let's deal with the enemy. The issue of the development of the province and the country needs us together, united, and that's how we must progress forward. Let us build and grow KwaZulu-Natal together. I thank you, Program Director.
Thank you very much, Premier. Thank you for your leadership. I don't need to expand further. We now have our final item, which is the closure, and it gives me pleasure to call upon Mr. Kubega, who's the DDG Stakeholder Coordination in the Office of the Premier, to do that closure.
Thank you so much, Honorable MEC. Greetings to your good self. Greetings as well to Honorable Premier, as well as Honorable MEC for Health, Mama Usmelane Ndabezit. Greetings as well to all the participants, as well as the presenters. For me, Honorable Chairperson and Program Director, is just basically to present to this webinar, Honorable Premier, the declaration. It's entitled The Declaration of the KZN Government-Powered 5G Technology Webinar, held on the 15th of January 2021. The KZN Government-Powered 5G Technology Webinar was held on the 15th of January 2021, seeking to achieve the following objectives. 1, to address the ongoing myths and misconceptions about 5G technology in relation to COVID-19. B, to create the ongoing platforms for government, public, and IT stakeholders and experts to engage on the importance of connectivity and digitalization in the province. C, to position KwaZulu-Natal province as the center for the fourth industrial revolution. The presenters, participants, and the entire people of KwaZulu-Natal province noted the following during the webinar. A, the United Nations certifies that 5G is in no way responsible for the spread of COVID-19. B, World Health Organization has, through its epidemiological and virological research work, certifies that there is no scientific link between COVID-19 and 5G technology. C, Africa's medical research institutions, scientists, academics, and IT experts also find no link between COVID-19 and 5G technology. D, 5G stands for the fifth generation of cellular technology, which is highly improved in terms of universal high rate of coverage, intelligence, and efficient usage. The webinar presenters and participants, all of them unanimously supported the decision of the KwaZulu-Natal government to hold this webinar at a time whereby the entire country is rebuilding the economy and the livelihoods of the people devastated by COVID-19 pandemic. It is therefore against this backdrop that the webinar provided an appropriate platform for the KwaZulu-Natal government to launch its campaign dubbed Reconstruct and Transform KwaZulu-Natal through ICT Agenda, which shall entail the following immediate activities. A, the collaboration between KZN government, network providers, and IT experts in rolling out the 5G community and stakeholder engagement or awareness sessions across the province. B, private sector is also being enticed to invest in the ICT development space of KwaZulu-Natal communities and facilities, especially in those areas which are still neglected. C, it will also entail enhancing the integrated communication in isiZulu and English on the ill-informed theories associated with the ICT development and 5G technology. D, it will also entail that KZN government shall hold a signatory session with the key KZN leadership stakeholders across socio-economic spectrum, provincially and in all districts, to endorse a common message about ICT development and 5G technology to reverberate in all villages, townships, and the towns of KwaZulu-Natal. E, it will also entail that the sixth administration of KwaZulu-Natal government notes with discontent the very poor state of connectivity in the entire KZN province, which currently on average stands at 27%. Hence, a webinar is hereby making a call to all KZN stakeholders, professionals, academia, and IT experts to submit succinct ideas of how best KwaZulu-Natal government, working with other role players, can implement the KZN digitalization agenda for possible consideration and pronouncement by the Premier during the 2021 State of the Province address. F, it will also entail that all KZN stakeholders, namely business, education and research institutions, citizens, civil society, interfaith leadership, and professionals, as represented by their formations, are hereby called upon to develop and submit in the next coming few days and weeks to the Office of the Premier their respective COVID-19 variant mitigation plans, through which these respective stakeholders shall seek to heed the call of the KwaZulu-Natal government of building a united front to intensify a fight against COVID-19 as well as GBV pandemic. We must note that this declaration, which is presented in English, shall also be translated into isiZulu for KwaZulu-Natal citizens and all stakeholders to be able to read and understand especially the KwaZulu-Natal government's plan to reconstruct and transform KwaZulu-Natal province through ICT agenda. I thank you, Honorable Chairperson.
Thank you, Mr. Kobelo, for that very clear and powerful declaration, which captures all the elements of our work. This is the start of the campaign, not the end. And I may just report that across all the platforms, Facebook, YouTube, and Twitter, we had 2,532 participants. That's the first battalion in this fight against this disinformation. Thank you, everyone, for participating. I declare this webinar adjourned. Thank you very much.